feeding at home.
Okay.
What do you already know about why Chris is receiving the tube feedings?
She's got an inflammatory response, so she's not able to swallow, and the feeding is going to be to help her receive the nutrition she would normally be able to eat.
Okay. And how do you feel about the tube feedings?
They're fine. I just want her to be able to get healthy.
Chris, how do you feel about the tube feedings?
I don't really like it, but the doctor said I had.
Chris,
Hmm?
what are your goals?
I want to go home.
Okay. Well, in order to go home, we need to make sure that both you and your mother know how to administer the tube feedings. So, do you mind putting your phone away and helping us with this for a few minutes? All right. So to start out, you're going to want to gather your supplies. Get her up to a good height so it's comfortable. And I'm actually going to talk you through the process and let you administer it so
Okay.
we know that you're doing it properly. Let's see right here. What we're going to do first is we want to make sure we wash our hands. We have some gloves here for you.
Sorry.
Alright, first you want to make sure you check the expiration date on the formula before you administer it. This one's good. You want to make sure the head of the bed is at least 45-degree ankle elevation, and that is so that if she were to vomit or that the fluid didn't go into her lungs.
Okay.
Okay, now that you've washed your hands and have your gloves on, you are going to want to clean the site with some sterile applicators.
Okay.
You're going to want to work from the inside out, just making sure to use a new tip every time you go towards the middle.
Okay, what do I put on the applicator?
Use sterile saline.
Okay.
Okay, so just
So put it in my saline, and then go from inside to the out, and I just go around the site.
correct.
All right.
Okay, and once it's clean,
Okay.
we're going to attach this extension piece onto the end of the tube.
Okay.
Okay. You're going to want to unclamp it.
Right here.
Now before the feeding, you're going to want to pull up some of the residual fluid.
Now, how much should I get out of this?
Well, I mean, you're going to pull until no more fluid is coming into the syringe, okay? It needs to be less than 200 to 250 milliliters in order to give her a feeding.
Okay.
If it's more than that, you're going to want to hold the feeding.
Okay.
That means she hasn't digested the last feeding yet.
Okay.
Okay, so
And-
once you've done that, you're going to, you've got, how many milliliters did you aspirate?
I have 20.
Okay, you're going to want to actually remove this syringe and test on pH paper
Okay.
just to make sure that it's in the stomach, that the placement is proper, and you're going to want to make sure that that pH level is below 5.5. So we've got about a 4 here, so we're okay. Now you can remove the plunger and reinsert the syringe. I've already got 50 milliliters of water measured out here. You're going to want to flush with 30 to 60 milliliters of water both before and after the feeding.
Okay.
Okay, now once that gets low, you're going to go ahead and add your formula right into the syringe. And it's going to take about 20 minutes or so usually to administer a feeding. You want to make sure that you keep it above her shoulder level so that it's going in at a nice steady rate.
Okay.
And once that's low, you're going to want to add another 30 to to 60 milliliters of water after the feeding to flush the tube again.
Okay.
All right, now that that's gone through, you're going to want to reclamp the tube.
Okay.
You can remove the this extension.
Okay.
And you're also going to want to remove the adapter. Just turn it
To where it says
to
unlock.
where the lines line up, and then go ahead and clamp that.
Okay.
Great. And we're going to wash the equipment with just some warm water and soap and make sure we rinse it really well.
Okay.
Okay. Do you have any questions?
How often should I give her the feedings?
Well, your doctor will tell you both how much formula to administer and how frequently she'll need them. And he's going to be in a moment to go over that with you.
Okay.
I have some directions right here that I'll send you with. It's kind of the step-by-step.
Okay.
Also here is when to call your doctor. If you see at the insertion site any bleeding, pus or drainage that smells bad, redness, swelling, or if she has any pain that's not relieved by medication. If she has any abdominal swelling, nausea or vomiting, diarrhea, constipation, or a fever of 101 or higher. Okay, and here's the telephone numbers that you'll need.
Okay.
Chris, do you have any questions?
How do I take my medicines?
Your doctor will go over that with you as well. Some of them can go through the tube feeding. I'm not sure exactly what medications you're on at the moment, but some of them can be administered right through the tube, some cannot. It is important not to mix them if you're going to administer them through the tube.
Can I grind up a hamburger and put it in there?
No hamburgers. You can have broth or even ginger ale if you have an upset stomach can go through there, but no hamburgers. Okay.
What should I do if it gets clogged?
If the tube is clogged, you're going to want to flush with the water, the warm water,
Okay.
through the tube, and that should alleviate any clogs. If that doesn't work, then you are going to want to call the doctor.
Okay.
Okay. Any other questions?
Should I be writing down how much food she gets?
Yes, you're going to want to, that's a great question. You're going to want to keep a diary. And in that diary, you're going to want to document the times you fed her and how much formula or other liquids that you've given her.
Mm-hmm.
You're going to want to weigh her at least twice a week and document that as well so that we know that she's not losing weight, too much weight, or gaining too much weight.
Okay.
And the doctor will adjust the feedings accordingly for that reason. You're also going to want to document any bowel movements.
All right.
And you're going to want to note the color, consistency, and those types of things.
Okay.
Okay? And this way we can track back to see how her progress is.
Okay.
Okay?
So now I just need to go wash this.
Yep.
No, I'm just ready to go home.
You're ready to go home? Okay, well, Dr. Young will be in a few minutes, and he'll discuss the additional information with you, and we'll get you on your way.
Okay.
All right?
Thank you, Nurse Ann.